Public Health, Deb Federspiel and Sarah are here with me, along with our city and county manager's office and staff. So we'll dive into the slides to make sure we have enough time to have Q&A at the end. So as far as changes we've seen since last week, we've had 91 additional people that tested positive, 3 additional hospitalizations, and I would need to dive a little bit deeper into the data to see which age groups these occurred in. And then thankfully no deaths, which is always good to see. Our positivity is trended down slightly. So if we go to the next slide. We've shown this graph a couple of times, but I just wanted to remind everybody, this is a metric that the Denver metro region is tracking now as we've moved away from the traditional dial order and framework. And this is a 14-day moving average of our hospitalization rate. The idea behind this is as we move into level clear after May 16th, we would then begin tracking this measure of hospitalizations to see where we're at. And if we ever did get to the point where we were in November and December and needed to move back to a level blue or a level yellow, we have that ability under our public health order. But what you can see from our trends is that it would take a significant number of cases and hospitalizations for us to get there again. Next slide. So as far as what we're seeing statewide, as would be expected, as we're seeing more mobility, our transmission control continues to decrease. We're at 51%, which has been our lowest since March of 2020. 1 in 88 people are currently infectious. Where we're seeing the steepest cases are continuing to be in those school-age children, specifically our middle school and high school students. And then much hasn't changed on the hospitalization front from what we talked about last week, that we're seeing hospitalizations shift more to those under the 65 years of age, and is most likely due to the fact that we've vaccinated all our older vulnerable populations and the vaccines work. In addition, we are seeing more spread of the variants, specifically the B117, which we just know is more transmissible, specifically in those that are unvaccinated. And then as we've talked about 37% of Coloradans are currently immune. And again, our modeling data is estimating that vaccine uptake is at 94% for those who are 65 plus and 80% uptake for those who are younger than 65. So we're just heading in the right direction as far as vaccines, but we want to see that uptake continue. The next slide. As far as what's happening in Broomfield, we're in this place of starting to see a sustained decline in incidence and a shifting, I should say, too, of our case incidence. And we'll see if this continues to occur as more and more of our Broomfield residents are vaccinated. You would expect that the case incidence levels off and starts to actually decline. That being said, we still have a fairly high positivity rate at 6.1%, which shows there is that community spread in those that are unvaccinated. And then our highest case rates for the month of April were among the 10 to 19-year-olds. And that aligns with what we just shared with the state data. As far as our vaccination progress, we're doing great as a county. We're leading the metro region in vaccine uptake. Boulder is second behind us. And we have 71% of our eligible population that have either initiated or completed their vaccine. 53% have completed and 17 initiated. So that's also good news to see those individuals that in Broomfield that have initiated the vaccine have followed up and got their second dose. And we want to hopefully see that continue to see that full level of protection. And then as far as variants, we still are seeing the trend with the B.1.1.7 variant. That's the one that's most prevalent in the state right now. We don't have any additional cases of the P1 variant, the Brazilian one that we talked about, that is more transmissible and the vaccine may not work as effective against that one. So we hope that that continues to be the case. And we'll just continue to track variants in both the state in our county, but we also have to be aware of these countries across the nation that have a large populations that are unvaccinated, could potentially be breeding grounds for additional variants to come up. And so making sure that as we move out of sort of the COVID emergency with hospitalizations, we still are aware of what's happening globally and how it can impact us here in Broomfield. Next slide. So as far as vaccine updates, some good news is the FDA should be making a decision shortly, either this week or next week, on emergency use authorization of the Pfizer vaccine. This is in children's ages 12 to 15. If that is authorized by the FDA, it'll follow a similar process where then it goes to the advisory committee on immunization practices. They would then provide the guidance for us to be able, and providers across the nation, to administer it to this age group. The good news, though, with the Pfizer vaccine is that the supply is already out there. So with this new age group, it's not like we're waiting on a new supply chain to come on board. We'll be ready to hopefully hit the ground running once this is approved, and have already started developing relationships with school districts and other organizations that work mainly with this target age group to make sure that they get vaccinated. Across the state, though, we are seeing that we're shifting, and we're seeing more no-shows and arising in those large vaccine sites, that there's people that are not necessarily registering as quickly as we were before. So the state has shifted to having these mass vaccine sites allow walk-ups in addition to offering the appointment slots. I just asked this question to the state if that's going to continue in other provider settings. They hopefully will be moving there. They're working with both the large pharmacies, the hospital systems, but counties on how do we make a shift to create more of that demand and provide the convenience locally for people to get their vaccines. As far as our local vaccine efforts, similar to these large sites, we're seeing a drop-off in people that are registering. So we'll be providing one more event at the First Bank Center for the first vaccine, for those that need the first vaccine. That'll be the Johnson & Johnson vaccine event on May 6th. Well, we still have to follow up some of our first and second doses also. And then after May 6th, we'll be shifting away and no longer offering first doses at the First Bank Center, and moving towards more of smaller targeted efforts in collaboration with our community partners to make sure that we create that convenience and get the vaccine out to those individuals who have not yet been vaccinated. Next slide. And then as a reminder, we're still in level blue, similar to the rest of the Denver metro region for our public health order. After May 16th, we'll be moving towards that level clear, the observation period, with the still strong public health guidance out there, and then tracking hospitalizations and see where we move from there. Next slide. And then as far as the statewide mask order, this Friday, the governor had shared that he extended the statewide indoor mask order, and it's been extended through June 1st. Some key things with it is where it will be required is for those 11 and older in schools, child care centers, camps, congregate care facilities, including prisons, personal services like barber shops and so forth. And then similar to what it had before, in places where 10 or more unvaccinated, unknown vaccine status are gathered in settings. As far as where masks will not be required is in indoor settings where 80% or more of individuals have shown proof they're fully vaccinated. That's they have a vaccine card or they have a photo of their vaccine card they received when they got the vaccine to share it with the others. The other situations will be in restaurant where 85% of the restaurant employees are fully vaccinated. And then again, those situations with when less than 10 are unvaccinated or unknown or individuals are gathering in these settings. And then finally, we're still getting some clarification on this, but counties with the COVID case incidence less than 35 per 100,000, this would apply in all settings other than those listed. I just completely botched that. I totally admit it. So I think Deb and I are going to have a lot of questions from everybody. But if you read the slides, you can see what it does require and doesn't require. Looking at this, though, I could tell you that our local mask order that we have in place, and again, it requires masks in all indoor settings, will expire on the 7th. We've had discussions with the rest of the region. Other counties in the region are going to keep their orders, but align it with the statewide order. 2 counties may keep stronger requirements in place. I think where I land and my recommendation would be that given when we had our first order passed, we didn't really have enough vaccine for those people that needed or wanted to get a vaccine. And so there was a need to keep masks in place. Looking at where we're at now with the number of Broomfield residents that are eligible that have been vaccinated, and in addition to that, the fact that most of these settings would be covered for our children that are more likely to contract the virus just because they haven't been vaccinated. I would recommend we let our mask order expire and follow the statewide order just for consistency purposes, both in the region and with the state. And then I think we have one more slide. Oh, and then we go to our appendices. So that's our presentation. And Deb or Sarah, anything you have to add before we open it up to questions? Okay. So with that, we are happy to take any questions you may have. Mayor Pro Tem.
Thank you, Jason. I too am trying to kind of process this most recent information about masks, and particularly with our starting to plan to go back to council meetings in person. I want to know, like, are we going to have to wear masks the whole time, or is there a way to verify that we've been vaccinated so that we don't have to wear masks for 5 or 6 hours?
Yeah, it's a good question. And actually, we've been in discussion with legal, and I see Nancy's on the call today, because the 2 public health orders really don't define what proof of vaccine status is. However, they do on the state website say that it could include having the actual vaccine card you received when you got your vaccine, or it could be a photo or it could be actually your vaccine records or immunization records that you got from a provider. So my assumption would be with council is that we would provide the same recommendation with mask order, that if 80% of individuals in that room show proof that they're not vaccinated, masks wouldn't be required. However, individuals for safety purposes may still choose to wear a mask, which would be perfectly acceptable and fine. And Nancy or Deb, feel free to jump in as you guys have been talking about this today. Does that sound good? Okay.
Yeah, I think you said it, and I just want to clarify, because I think you might have said unvaccinated, Jason, but 80% show vaccinated, 80% or more.
That's correct. Okay, I think Councilmember Groom's next, unless you have any additional questions, Mayor Pro Tem. Okay, Councilmember Groom.
Yes, thank you. It's amazing that we're at 71% with 53% verified or completed. What number do you think we need to reach to get to the herd immunity that we've been talking about?
Yeah, it's such a difficult number to actually pin down, because even at the state level and national level, everybody says somewhere between 70 to 80%, you start to achieve that herd immunity. They're basing that on looking at Israel and other countries where they've successfully vaccinated their population and they saw cases and hospitalizations go down. The one caveat, again, is potential variants that could be introduced and run through your unvaccinated population, but the target is somewhere between 70 to 80%, Councilmember Grimm.
And how does that work in regards to county, region, state, country, world? I mean, you would think that, until the world is at 80%, is really herd immunity gonna matter if Broomfield is there or not? Can you talk to that? I mean,
Sure.
is immunity matter until the world gets there?
Yeah, it's a great point. When you're in a place of a pandemic, it means it's spread worldwide. And we know across the world, there's quite a few countries that are nowhere near where we're at as a country with vaccinating our population. The one caveat I would say, though, is looking at the data as a country and in our state and locally, we know that these vaccines are highly effective and extremely effective in preventing hospitalizations and deaths. So it still is a good measure to be aware of as you start to say, what do our public health guidance and recommendations look like as we move forward into the fall and winter?
Perfect, thank you. And then I know I asked this question before, and I'm sorry if you answered it and I forgot already, but the B117, I know you had mentioned that we had 30 cases. Do we know if those cases have occurred in anyone that has been vaccinated or had the previous COVID virus? Or is these people never had COVID or never been vaccinated?
Yeah, I believe you did answer that or ask that question, Councilmember Grimm, and I'd have to follow up if Deb and Sarah know off with our EPI team if we know that. If not, I apologize, and we'll make sure we get an actual response back to you.
Unless Sarah knows, I don't know if we have the breakthrough data at the county level for that particular question, but
or even if it's happening at a state or country level, like people that are getting these second strands, or I don't know what they're called. Are they morph strands or second strands or different strands? Are they getting them if they're vaccinated, or are they getting them if they've already had COVID? I guess that's my question. Maybe not just in Broomfield, but overall.
Yeah, well, We'll definitely follow up and share that, Councilmember Grimm. Statewide, I showed a slide last week that shows that when you look at hospitalizations and the breakthrough cases, the rates are extremely, extremely low for those individuals that have been vaccinated. So that means we're not seeing as many breakthrough cases in individuals that are vaccinated versus those hospitalizations and with those that are unvaccinated. But we'll get a answer out to council.
And one of the bullets on one of the first slides, I think it was 71% has either been vaccinated or previously had. I forgot what it was stated. Sorry to make you go back.
Yeah.
I thought I put it down, but I'm so sorry. Read my writing. Or previously infected. About 37% of Coloradoans. If we're counting or previously infected, has anybody discussed antibodies? I know you had mentioned having your card for previous, but the people that, I know you don't want to hear this, but are choosing not to get vaccinated, but want to track their antibodies, they can go get antibody tested, and they can do that on a regular basis. Is that going to be offered as an exception to the vaccine?
It's a great question. And the way they're currently tracking this is in the modeling data, as far as those individuals that previously contracted COVID. And from there, they're trying to get an idea of how much of our current population is immune for removing some of the public health orders and restrictions. As far as how that information would be used in other settings, I haven't heard the state discuss that, Councilmember Grimm. So let me bring that back to the state and see if I could get a response.
I know right now they're doing blood studies on people that have been currently or previously infected, and since way back at the very beginning. So it'd be really interesting to start seeing those studies and to see how the health departments are going to start incorporating that data once we can get to herd immunity, if there's going to be any exceptions. I know there are some people reaching out asking what those exceptions would be, but I know we're still focused on vaccinations, and I support that wholeheartedly, but just wanting to know if there was any discussions behind the antibodies testing.
Yeah, I'll bring that back to our next meeting and make sure we actually have it incorporated into the slides. So Mayor Quinn, I see you're up next. Thanks, Councilmember.
Yeah,
Thank you.
Jason, do you mind if I take advantage of this time to talk a little bit about going back into chambers?
Sure.
Since I'd sent an email last week, and it's like it's like the governor anticipated these questions when he came up with his rules. Because I'd sent Jason a note on Thursday or Friday, what were the rules that we were going to have to follow, and so I just want to say this is something the Mayor Pro Tem and Jennifer and Jason and I have talked about. But as of this point, we would go into session on June 8th. We've all seen the double dais, and so there is 6 feet separation. I would want to take advantage of the rule the governor said, so that 80%, if 80% of the people in the room were vaccinated, then we would go ahead and not have a mask order. Jennifer seems to think that between council members and staff that we would have 80%. I agree with that as well. What I wanted to say, and that is also an argument as to why we would allow staff, and I don't know where Jennifer's at and she's on the line, but I'm assuming she'd want staff to be in the room that's making presentations. We could control whether they, we would know whether they would have been vaccinated or not, but we will not allow any presentations from the outside to come in the chambers. And so, it's kind of coming together, and just let council know that. And if there's huge objections to that, but my intent would be to go ahead and meet in session on June 8th. Go ahead and under the assumption, and I think it's fair assumption right now, 80% of us would have vaccination and could prove it, whatever that means. And I think it does mean the cards. And and that we would maintain our 6 feet of separation. We probably wouldn't go to meals yet and stuff like that. But just since we're on this call, that's where I'm headed, and I think the mayor pro tem agrees with that.
I do, except for the meal part, because now when
Yeah.
are we supposed to eat dinner? I mean,
Yeah.
really?
Well, maybe we do have the meals. I jumped. We hadn't discussed that.
Yeah.
So maybe we do have meals, because theoretically, if we've been vaccinated, then we're not worried. And Jason, as you will know, I read everything about the variants everywhere to see if the vaccine is effective. And almost, 100% of the time, it seems like the vaccine has succeeded. They're worried about it in the future because these variants are getting rapid. So. Yeah. So I just wanted, since we had 6 members of council on here, wanted to go ahead and that's what we're thinking right now. And I guess we're also thinking about dinner.
I could tell you if dinner's included that food and also services are not the main modes of transmission now. The CDC has looked closely into that. So I think you guys are heading along the right track.
Yep. Okay. I just wanted to say that.
Thanks, Mayor. Any additional questions?
No.
Okay. Councilmember Lim?
I had other questions, but I'll start with following up with what Mayor Quinn said. So we were emailed to respond if we had received the vaccine or not, but Mayor Quinn seems to be indicating that we may have to show our vaccine card. Is that what we're talking about additionally then?
Yeah, and I'll turn it over to Jason and to Nancy. But the governor's order uses the phrase that for people have to prove that they have the vaccine, and so the answer is so Nancy, I'll with that lead in, I'll leave it to.
Yeah, thank you, Mayor. When we were discussing this last week, we were just talking about making a request and people would provide the information and be given deference. But with the governor's executive order now, to be in compliance with that order, we would have to make sure we're checking the proof, the vaccination card or a verifiable record.
Okay, that's good. That's the clarification then. Following up to the herd immunity discussion. So there have been experts in various media reports who have expressed concern that as to whether or not we will reach herd immunity by fall, even in the United States. And then they refer to the fact that we just may end up kind of permanently with a manageable threat, and that under those circumstances, then if we don't have people who get vaccinated, it will, and there's a higher positivity rate, that it will allow the increased number of variants just because it's spreading in different bodies and it'll mutate. So can you comment on that future picture, I guess, of this kind of lack of herd immunity and what we'll see then?
Yeah, that's the key question everybody's trying to answer is, one, are we on track for herd immunity? Do we achieve it? And if we don't, what does it mean for us as a public health community going forward? I can tell you that we do know that the vaccines are effective. They work. So people that are getting them, it does reduce hospitalizations and reduces death. I think is playing out in the real world right now. The second thing is, if you are unvaccinated and contract COVID or one of the variants, there is the potential for greater severity with some of the variants. So there would be potential for more spread within an unvaccinated group because the virus is just basically trying to figure out how it survives, which is going to another host. And then thirdly, depending on what that number would be, it could increase the chances that you would have either variants originating within that specific state or in this country, or as I mentioned before, in other nations around the world that haven't achieved that level of herd immunity. So I think it's just something we're going to have to keep watching, Councilmember Lim. And as part of our public health surveillance is watching what happens as the pandemic progresses, and if the vaccines continue to be as effective as they've been, to Councilmember Groom's point, as we get more and more data and science, what's the level of immunity you expect if you've just come down with COVID? And then lastly, what's the level of transmission we're going to see with some of the variants that are currently out there or others that may pop up?
Okay, thanks. And as we spoke about moving away from the large First Bank site and into the smaller settings, we had talked last week about the possibility of business sites hosting vaccination clinics for their employees. Have we received any interest in that from our own businesses?
Yeah, I'll let Deb take that. She's been working closely with the team on defining our next vaccine strategy and what it looks like.
Sure. Yes, our team is working with local businesses, and I think what we are trying to determine is what strategy is going to make sense depending on the group that we're trying to serve. So for instance, if it's a few individuals that need appointments, it might be more expeditious to connect them with our pharmacy partners. We just learned this week that King Soopers is going to start allowing walk-in appointments in addition to the scheduled appointments. I think there will be some variances across the stores as they start to roll that out, and we expect other pharmacy partners will follow suit. They too are making these shifts. So it may be facilitating access for individuals through some of those channels makes more sense. In other cases, depending upon the number of employees needing vaccination, it may make more sense for our team to go to them. And so we are working on a combination of strategies so in addition to the mobile option, where we would take our mobile vaccination unit to different sites like a farmer's market or a workplace, we're also working on where we might be able to offer a consistent static location so that individuals know that they can seek appointments there. So we're in the process of exploring and making plans with different community partners. We're working with all of our local nonprofits and others, just getting some additional feedback from them about what would work best, so that then our plans can be responsive in terms of, is it timing, is it location, what are some of the other components that we need to take into consideration to support people getting there. So it'll be a combination of strategies. I think with each week we'll have a few more details that we'll be able to share as we get deeper into that shift. And we'll be in that place throughout not just May, but heading into the summer, and certainly continuing targeted efforts if and when the vaccine becomes available to younger age populations, and working through channels to reach families where they are there as well, through their existing providers, as well as some of those community partners.
Okay, thank you.
Thanks, Councilmember Lim. Councilmember Anderson.
Thank you. I think my questions all kind of around herd immunity. And Deb just gave an update of, when vaccines become available for children. But while we're waiting, I'm just curious, if we're really going to reach herd immunity, I guess this is a two-part question. What percent of, I guess, focusing on Broomfield's population, what percent of our population is under 16? I mean, are we we're kind of relying on pretty much almost everyone older than 16 to get that vaccine, to get the herd immunity. Is that kind of a fair assumption? That percent of our population is?
It's a good question, and I don't have the data in front of me as far as what percentage of our population is under 16. I would say that what we've been approaching this from is, at what level do you keep public health orders in place as you're achieving that level of herd immunity for all populations in a community? And the balance we're trying to achieve is keeping those mitigation strategies in place with masks in these settings through the state order. In school, we still have the school guidance that provides the ability for that contact tracing, isolation, quarantining that needs to take place. And then being very clear with the public of what are those environments, as the CDC has put on their website, that are riskier as you're going out as a either unvaccinated individual or bring in your unvaccinated child. So I would say you're correct, Councilmember Anderson, that we are moving to this place of level clear without having our kids, and I would say all the way from age, 1 all the way up to, or 2 to 16 vaccinated. However, there are really strong mitigation strategies in place for those populations.
Yes, thank you. I was thinking that it was, really takes, we're looking to have such a high percentage of those that can get the vaccine to cover those who can't. And then there's that question of, how much immunity do you have from having COVID-19? And that's probably varies from person to person, I'm assuming. And then, so if you've already had COVID-19, like how does that compare to the actual immunization? But then this is a question that kind of came up in my mind was, we're already thinking about variants and booster shots. And I don't know if you probably don't have the answer to this question yet, but if you haven't had your, first Johnson & Johnson or your 2 shots, could you even get a booster shot? To get a booster shot, would it require that you actually have had the actual the first series of shots?
Yeah. Well, with all of this, what you're talking about is building enough immunity in your body, either through the vaccine or if you've contracted COVID. And I'll get the data, but we know that the level of immunity is much higher if you actually get the vaccine. And then from there, you're exactly right that there's a waning level. So the immunity drops off over a period of time. And during that period of time, this is what they're trying to pinpoint. At what point do you need a booster? Is it going to be in 6 months? Is it going to be in 4 months? That's what the advisory committee on the immunization practices, because a lot of the pharmacies have been saying, here's what we believe the booster process is going to look like. But that's data that's going to have to be submitted, go through the same process that we've gone through with just getting the first doses out to people. And to your specific question, if somebody would need to follow that same process if they just get a new vaccine and they hadn't received the vaccine previously, my understanding is you would need to treat it like any other vaccine, that you're building up the immunity through a first dose, a second dose, and then you would be getting a booster to keep that level of immunity up in your body.
So maybe that becomes a part of our public health messaging as we move closer to understanding. I mean, perhaps somebody's working on a booster shot for those who've had COVID, but if not, like don't delay, start now, because that having had COVID is not going to carry you through potentially. And that was just the thought going through my head as I'm strongly considering, my kids are ready when it's approved. They're saying they'll do it, but there's a risk, in vaccinating younger children too, that I really hope that that the adult population kind of takes that more seriously. And Jeff Romine did include in the chat, and I just lost it's just here. It was 17 to 20% of that younger population. That's what makes up there's 17 to 20% of the population. So yes, we really, I just feel strongly that we really need to get some messaging out there to say that we all need to, if we are capable and able to do our part. And I know so many people who didn't get the vaccination because they thought they needed to get it for themselves. But after talking to myself or somebody else, it's like, they're like, well, I'll do it for others. And I just think that's a very noble thing for people to get to that point of saying, I'm going to do this to protect others. So that is all my questions. Thank you very much.
Thanks, Councilmember Anderson. And I just want to reiterate your point because I think it was such a important one, that with COVID and the seriousness of the hospitalizations and deaths associated with it, I would strongly encourage everybody to get the vaccine. It's always a risk benefit analysis you weigh as a parent or as an individual, but the data we've seen with these vaccines is they're highly effective. And there actually are very limited risks from side effects or anything else occurring with them. And so I think it's to your point that in order for us to get past this pandemic and move on as a country, we really need to get to a point where people are getting that vaccine when they have the opportunity. Let's see, Councilmember Hinkle, I believe you're up next.
Thank you, Jason. Thank you guys for all of this. This is a good, always good continuous conversation, and especially when we talk about, we've been through this through a whole year, and then financially we need to figure out, how we're going to get through all of this as well. So I have two questions. My first question is more health related. My second one is going to be more business related. So Jason, I know that we're talking about boosters and we're talking about, the COVID vaccine itself. I know that the FDA did sort of an emergency approval. At what point are we going to see like a full-on approval? And then I'm also hearing, I get a lot of National Geographic emails, and they really do a deep dive into the vaccines. And they're talking now about the vaccines and how they're looking forward to not using as cold of temperatures. So I don't know if you guys know of any future of the vaccine itself, what it might look like, or what you guys have heard of in the way that the mRNA is going to be sort of stored in the vaccine. I know they store it in like a lipid-based product or whatnot. So I know they're talking about folding it better. I'm not totally sure about all of that, but do you know what the future of the vaccine kind of looks like for COVID?
So what I can tell you is the FDA continually looks at the data that's coming out on these vaccines. As far as the timing to go from emergency use authorization just to full authorization, they issued the emergency use because we're in this place of a pandemic. He needed to get the vaccine out. So that's more of a discussion at that point in time. Okay, when do we feel it's good enough to just say you're authorized with this vaccine? As far as the storage and other temperatures and so forth, I think it's a good point because there's such vaccine development still occurring with the pharmacies out there. It'd make more sense to have Helene Lanz or Dr. Urbina on the call who know the specifics of the vaccines and can answer those questions. So maybe our next call, we can do a deeper dive into both that and the deeper dive into those that have had the previously contracted COVID and that level of immunity they can expect from that, since those are two key questions that have come up on this call.
Yeah, okay, great, fair enough. My second question is for Jeff, and just sort of talking about, they're having a hard time in the restaurants just getting people to get back to work, and they're having a hard time hiring people. What is sort of the boots on the ground hearing about, hey, I know it's COVID, if you have your vaccine, let's get back to work. What does that look like as far as our business owners and really being able to hire people? Because I just feel that I see it everywhere. We're hiring restaurant workers, but they're not coming back to work, or they're just having a hard time finding workers. What does that look like now, and what are you thinking in the future?
Councilmember Henkel, two ways to answer that question. First off is, yes, in fact, I think it was the Wall Street Journal either Saturday or today was talking about it as a national issue, which is because of some of the stimulus and some of the things, and quite frankly, some of the fear that individuals had about becoming exposed and oftentimes being a vulnerable population, people have avoided coming back into those types of jobs. So, as the vaccine continues to roll out, as public health becomes more assured for the employees too, I think we'll see some of that changing. At the same time, there's a conversation that Councilmember Lim may also recall is this is one element of what the Workforce Center is working on and trying to think through how we can encourage people to come back in. The underlying issue for some of these employees, and I don't want to paint it too large of a brushstroke, but nevertheless it is real, is the fact that schools are still working through some of these things, and therefore childcare at all different levels, even for middle school kids and things, is how do you return to a workplace when you're doing primary care and primary oversight of educating your children at home. So I think what we're going to see is as we continue to move forward, both with the public health side and the economy, that hopefully by August and when we begin to see kids returning to school, we're going to see an enlivened workforce coming through too. So it's something that the workforce board has talked a little bit about. It's something that Chris and I have talked quite a bit about, and we'll continue to focus on that, is how to make sure our businesses can get back up to full strength, as your point is well taken.
Yeah, thank you. Yeah, I would really like to see some sort of education on that. And then also just feedback, like where can we be supportive with childcare? Where can we be supportive with, the hesitancy of possibly, getting sick again, or just the education on the vaccine, and what that might look like. Because I know that our business owners really are struggling with that. And then so are parents too. I understand we're going to be doing asynchronous on Wednesdays for quite a while ourselves. So, and some people did opt to do online all year long. And now they gave their 16-year-old the vaccine, and now they're like, well, do I send them back to school for the last 3 weeks of school? Probably not. So, it's interesting just to sort of see the dynamics and what that looks like.
And I don't want to put a positive spin on this, but at least for both my teenagers, they've had no problems getting jobs. And so this will be a good year for kids to be able to work this summer as compared to some others. Is the competition will be different than what we've experienced in the last few years. So I that doesn't mean you should ever sacrifice your health, but as we're continuing to move forward and you can get 16-year-olds can get vaccines and they're readily available, it can be a positive work environment for them. So I'll stop there.
Definitely. No, that's the only way I got my son to go back to work is if he got a vaccination. So yeah, he's doing his minor employment work. It's kind of interesting. Thank you.
Thanks, Councilmember Hinkle. And Councilmember Lim, I saw your hands up, so I wasn't sure if you had an additional question.
Yes, I'm sorry, I did. So with the governor's orders where you can skip the masks if 80% of the indoor setting is vaccinated. I understand why there's a need to move in that direction gradually, but it seems slightly hard to enforce or to validate as far as, of course, we're talking about going back to council. We're a static group. We would know if 80% of us are vaccinated. But if you're in an indoor setting where there's a lot of, transient people going through, have there been conversations about, businesses being confused in Broomfield as to what they're supposed to be doing? Are they supposed, or is there conversation about how residents might report to us that they're going to feel uncomfortable in indoor settings, not knowing who's vaccinated and who's not in a business setting, but yet the business owner has decided not to check, because it's not really enforceable? If you understand my question there about the confusion.
I do, Councilmember Lemon. Actually, it was something that as we got the notice that the order was going to be released, it was the first question that went through my mind and Deb's mind is, first of all, what's the intent, and then how will this be enforced? And to be honest, that's what we're looking at with legal right now is what's required for proof of documentation, and then what would be that level of compliance that we would follow through on. And my assumption is it's going to be what I think is happening is that the responsibility is being transitioned over more from a big public policy approach more to the setting approach. And so it'll be incumbent on those settings to define how they're actually tracking vaccination status, if they are going to let people not wear masks. And then secondly, like what level of documentation are they keeping, stuff like that. So if we got a call from somebody saying, I went to such and such business and there were all these people there without masks, and we wanted to look into that, we'd be able to check and see what it is. So that's what we're taking this week to do, is digest the language in the order and what the education needs to be to our partners and business community. So it's clear on that side as well.
Okay, thank you. I mean, there's some settings, walking in a grocery store. I mean, that's completely temporary. Who's in that grocery store and who's not? There's no way a business can verify who's in there and if 80% of them are
Yeah, I think you have
vaccinated.
to, my assumption is you have to go back to what the intent is of the language in the order versus the actual implementation. And I think the intent was trying to get in those settings where you do have a fixed group of people, being able to allow individuals that we know the risk of transmission is low once you have been vaccinated, allowing those settings to be able to not have to wear masks throughout the entire day. But again, this is a state order, so we just need to digest it and communicate it as we learn more.
Okay, thank you.
And Councilmember Grimm.
Sure. I guess now kind of continuing with that conversation, how do you get around Hipaa laws? I mean, so you're asking a restaurant to actually take medical information by name and write it down and track it of who's in the restaurant with what medical like that. I don't know. That doesn't sound legal to me.
So I would have to defer to the lawyers and not make a legal interpretation. I think the difference here is the individuals would be self-disclosing their information to say, I'm giving you this as an employer to show that I don't want to wear a mask, because I know that's the intent of this, focusing on that. If 80% of people in that setting also disclose that same information and willing to take that step, it's self-disclosure versus the business saying, demonstrate or prove to me that's the case. But I'm going to defer to Nancy and Pat, who are actually experts in this area.
I can, I can answer that. With respect to our role as an employer, you have to take a look at not just the information, but what role is that person playing? So if you provide medical information to someone who isn't a covered entity, who, for example, your employer, for example, the King Soopers, they would not be they're not a protected entity under Hipaa laws because they're not providing you medical care and they're not your healthcare plan. So in that context, it's not protected health information that's subject to Hipaa based on the role. Does that make sense?
So if I walked into King Soopers and I provided that information, you're saying it's not a HIPAA issue because they're not providing health insurance for me.
That's correct. I'd rather use let's use the play it again sports because they don't have a pharmacy. But in that role, if you're not talking to the pharmacist or you're not getting a COVID shot from the King Soopers, you're just going to the grocery.
Yeah.
That is, then that is not, HIPAA would not cover that transaction of information.
Interesting. But how do they keep track of people coming and going? They're going to have to take a list, and as you walk out of the restaurant or out of the store, and they're calculating 80% of people and recalculating it with every table that turns over.
That is the question that we are wrestling with. And Councilmember Lim pointed out, it's just we're trying to figure out what that is, and the businesses are going to have to develop and we are going to have to develop our own answer to that complicated logistical problem.
Huh. All right, thank you.
Mayor Pro Tem.
Thank you. Councilmember Groom's questions kind of brought up some questions for me, because we know that people that have been infected before can catch the variant, correct? With all the vaccines, they're not 100% effective. So there is a possibility that, or I should say, if you've been infected before, yes, you can
potentially contract the virus again.
And be asymptomatic.
Correct.
Okay, here's another scenario. What about having to have a negative COVID test? If you're vaccinated, can you get tested and will it show that you're negative if you've been vaccinated?
Is this specific to the chamber conversation or
Mhm.
broader?
No, chamber.
Okay. Yeah, I didn't consider that. So let me look into that, Mayor Pro Tem, and see.
Well, I asked because I live with a vulnerable family member. She's 94. And I just don't want to do anything that puts her at risk if I go into an area that I might be exposed, because I've been super careful for the last 15 months to keep my family safe and COVID free. I just want to know, like, what kind of risk are we talking about? Because there are also council members with children who can't get vaccinated. And I know there is a real concern. So I guess I just need to know, what does this risk look like?
Sure. We'll look into that and make sure we follow up. I mean, there's 2 points to this: is what's the level of risk as a body you guys want to take, and then there's what's the public health recommendations. It's like what we did with kids going back to school. We had very strong mitigation measures in place on top of where we were with vaccines or not having vaccines, just to make sure it was safe. And I think that's sort of this debate we're having right now, is what makes you guys feel safe enough to be able to do this? And that's a little bit of a different conversation too.
Maybe a plastic bubble. Thank you.
You're welcome. Well, I know we dove into a lot and we have a lot of stuff that we promised to follow up on. So I'll get with our team, and appreciate Nancy and tapping on the call. We'll follow up on the questions regarding the mask order. And then obviously the recommendations for council and going back into session are being coordinated through the city manager's office. So Mayor Pro Tem, I'll look into your question and make sure we give that information to the city manager's office.
Thank you.
I appreciate you guys. Thanks for the questions.
Thank you, Jason. Thank you, team.